The serotonin system in the brain does not evolve normally in an animal that doesn't have a microbiota. Behavior is not normal. When I say a diverse diet, the most extensively studied diet is the Mediterranean diet. And we know that that gives rise to a diverse microbiota and is the optimal diet from a mental health perspective. If you look at people who engage in, let's say, moderately severe significant exercise and who run a lot or who cycle a lot, they tend to have a far more diverse gut microbiota than people who don't.
Before we dive into today's episode of the Mental Wellbeing College, an important disclaimer. We do dive into the weeds of mental health, which means that at times we discuss sensitive topics like suicide, self-harm, and substance abuse. If hearing such discussion does bring up distress for you, please do seek the psychological and professional treatment that you need. The content covered in this episode is not intended as a substitute for professional mental health treatment. Hello everybody and welcome back to the show. Today we are joined by Professor Ted Dinan, a professor in psychiatry and psychiatrist at University College Cork in Ireland. Ted is a prominent researcher and one of the global experts in all things gut microbiome and mental health. And that is indeed the topic of today's conversation. In today's episode, we discuss the link between our mental health and the gut microbiome, how changing and intervening on our diet can change the impact of the gut microbiome on our mental health, and the role of supplements and prebiotics and probiotics on impacting our gut microbiome, and much, much more. If today's episode of the Mental Wellbeing College brings you value, as always, we'd be so grateful if you were to hit subscribe or follow, as this is how we continue to grow the show and communicate evidence-based psychology and mental wellbeing strategies out to the broader community. Now to today's episode with Professor Ted Dinan, where he dives in straight away into what the gut microbiome is.
It is only within the last 10 to 20 years that the microbiota within the gut has been considered as important. So we now talk about the brain-gut microbiota axis. Microbes within the gut, when I was a medical student and, for long after that, were really regarded as simply commensal. We fed them, maybe they produced one or two vitamins like vitamin K, but they really didn't have any great role in terms of our overall health and particularly our mental health. And it's really only within the last 10 to 20 years that it's become clear that gut microbes play a role in mental health and indeed in the health of many other organs within the body as well.
So when we say microbes, Ted, for the uninitiated like myself, for the psychology majors who have any idea what a microbe is, what is a microbe?
Okay, there are a variety of microbes within the intestine. The most widely studied microbes would be bacteria, but there are viruses, there are fungi, there are a variety of different microorganisms within the intestine. The reason most of the focus has been on bacteria is that within the human intestine, within the human intestine of your average adult, there are about 1.5 kilos of bacteria. So that's about 3 pounds of bacteria. Now, for those of us interested in psychology or psychiatry, that's the weight of the human brain. So basically, the bacteria in the intestine weigh about the same amount as the human brain. But it's actually, from a biochemical perspective, is actually very complex and very sophisticated. And it is clear, humans have never been sterile. We've never been free of bacteria. We've evolved with bacteria. We've co-evolved with them. So the DNA within bacteria is very complex. And that DNA gives rise to the production of a wide variety of molecules, many of which we absolutely require because we can't produce them ourselves. So we do feed these bacteria. They are commensal in that sense, but unlike what we might have thought 30 or 40 years ago, these bacteria produce an array of molecules which our bodies require. Now, there's a large amount of DNA in the microbiota. And if we were to take all the DNA that we require for normal physiological functioning, and we were to put it into our cells, in other words, if we were sterile, let's suppose we didn't have any bacteria, or we were to take all the DNA in those bacteria that we need the product of, our cells wouldn't be big enough to hold all of that DNA. So really, we've co-evolved with microbes, and we feed them, and in turn they produce a vast array of molecules. But really, our functioning would not be normal if we didn't have access to the DNA of the microbes. And, one might say, well, how do we know this? Well, one of the ways in which we know this is, we've published quite a few papers looking at germ-free animals who have no microbiota. So they're absolutely germ-free. And their brains do not develop normally. Their behavior is not normal. They don't have a normal, most of your listeners will be familiar with the serotonin system in the brain. It's important from a mental health perspective. The serotonin system in the brain does not evolve normally in an animal that doesn't have a microbiota. Behavior is not normal. If you take a mouse that's germ-free, mice are sociable creatures. If you give them the opportunity to interact with another mouse or with an inanimate object like a pen, they're going to interact with the mouse because they're social creatures. But an animal that doesn't have, that is germ-free and that doesn't have bacteria in its intestine is as likely to interact with the pen as it is with another mouse. Now, the term autistic is used far too loosely, in my opinion, nowadays, but, in a loose sense, it's an autistic pattern of behavior. So we need microbes for normal brain development and for normal behavioral function.
So in terms of that normality then, Ted, do we have any idea as to what a healthy gut microbiome looks like? Is there any indication as to what that might look like in a human?
Right. Now, a lot of people nowadays are sending off fecal samples and they're microbiota analyzed. And to be honest, we still don't have a clear definition of what dysbiosis or an abnormal microbiota is. But what we can say is this, that when a baby is born per vaginum through its mum's birth canal, it picks up its initial microbiota from the mum's birth canal, and those microbes are mainly lactobacilli. So a baby born naturally has a very narrow gut microbiota. In contrast to a baby born by cesarean section, cesarean sections, the initial microbes are obtained from the skin of the doctor, the skin of the nurse, or from the general environment. So it's a baby born by cesarean section is a much more diverse microbiota. Now, of course, in Australia and indeed in Europe, the cesarean section rates are increasing very dramatically. I think in Australia, C-section rates of around 30%. We do in Ireland as well. The World Health Organization recommend that the C-section rate be 12%. So we're clearly, doing more C-sections than probably is necessary. But one of the implications of that is that the gut microbiota of those babies initially is different. Now, over the first 2 to 3 years, whether you're born by cesarean section or per vaginum, there's a convergence of the gut microbiota. So by year 3, it's very difficult to distinguish one microbiota from the other. The healthy adult has a very diverse microbiota. So whilst initially we want low diversity, for health in the adulthood, we want to maintain diversity. When you look at elderly people, the elderly people who retain health in old age tend to have a diverse microbiota. There's a very good study from colleagues of mine here in Cork. It was published in Nature. They're in a group headed up by Paul O'Toole, and they're called the ElderMet group. And they showed that really, the onset, a lack of diversity of microbes in the elderly precedes the onset of frailty. Now, no one wants to become frail. I mean, we all want to grow old in a reasonably healthy way. But maintaining diversity in old age is essential if one isn't going to go on a path of frailty and, of course, eventually also decline in a variety of ways. And so, diet is obviously the determinant of, one's microbiota early on. I mean, breastfeeding is better than bottle feeding. That's generally accepted. Mm-hmm. And that tends to sustain low diversity of the microbiota earlier on. In adulthood, the more diverse the diet, the more diverse microbiota. And, the problem, I think, with some elderly people is that their diets do become less diverse, particularly in nursing homes or whatever, and frailty can follow very rapidly after that.
So that's really interesting. You mentioned the mechanism of diet and nutrition there and diversity. When you say diversity, Ted, what does that look like? Is that just, a wide range of food groups? Is it particular foods that we should eat more of that lend itself to a more diverse gut microbiome?
Well, I think that, when it comes to mental health in particular, and that's something obviously as a psychiatrist, I'm interested in mental health, and I'm particularly interested in the fact that, if you go to a psychologist or a psychiatrist, you're rarely given dietary advice, which I think is an awful pity. Hopefully it's changing, but it really is a pity. When I say a diverse diet, the most extensively studied diet is the Mediterranean diet. And we know that gives rise to a diverse microbiota and is the optimal diet from a mental health perspective. So if one is talking about depression or other aspects of mental health, a Mediterranean diet is generally regarded as the optimal diet. So what are the key components of an optimal diet? Well, I think having fruit and vegetables is essential. Nuts can be an important component of that diet, and fish is an important component of that diet. Maintaining an input of red meat that is not excessive. I mean, red meat is not particularly good. A lot of people in Ireland eat a lot of red meat. Red meat I would not regard as particularly good from a mental health perspective. Having an intake of fermented food is exceedingly important. When I was growing up here in Ireland, I mean, the only fermented food that was available really when I was a kid would have been yogurt. But now, of course, you went to any food store and you'd see kombucha, kimchi, you'll see at least 5 or 6 different fermented foods on the shelves. And so things have changed a lot. And I do think that is good from a mental health perspective. But it's actually interesting, when you look at mental health, back in 1905, Mechnikov, who was a Russian, won a Nobel Prize. And he won the Nobel Prize for a work that I think it's still a pivotal work. He basically toured through Bulgaria, and he noted the fact that in Bulgaria, those who had a big intake of fermented food, in other words, they were taking bacteria in on a regular basis, had a far better physical and mental health than those who didn't, and they lived much longer. Now, most people now, if they think of Mechnikov, think of, the fact that people who are on fermented food tend to live longer, and certainly he did suggest that. But if one reads, he published a book the year after he won the Nobel Prize in 1905. And around that year, he published a very famous book. And certainly in that, he is claiming that people who eat of diet that are rich in fermented food do actually have much better physical and mental health. And interestingly, I think it was around 1910, so about 4 years after he published his book, there was a meeting. Most people would have heard of Bedlam or the Bethlem Royal Hospital in London. Okay. And there was a consultant in the Bethlem Royal Hospital who presented a paper at one of their meetings. The abstract is still available. And he really suggested that lactobacilli would be useful in treating people who have mood disorder, and I think there's certainly a logic in that.
And lactobacillus, or is that one of the strains of bacteria?
Yeah. I mean, when we talk about probiotic bacteria, we're talking about bacteria which are good from a health perspective. Now, I introduced a concept which seems to have taken off. I introduced about 12 or 14 years ago of psychobiotics. And psychobiotics are a specific class of probiotic. They're probiotics that have a positive mental health benefit. Now, most probiotics don't. Most probiotics do not impact mental health, but psychobiotics do. And the currently described psychobiotics in the literature are indeed commercially available, are either lactobacilli or bifidobacteria. So they're within those two categories of microbes. They're either bifidobacteria or lactobacilli.
Okay. Hello, everyone. A quick break from today's episode. At the Mental Wellbeing College, we are committed to the goal of communicating evidence-based wellbeing strategies out to the broader community. The goal of this podcast is to bridge a gap between self-help material and peer-reviewed research by providing evidence-based discussion that respects the nuances of psychology, but is digestible for all audiences. Ultimately, I hope that you as a listener feel empowered after each episode so that you can take away and implement strategies to improve your own mental well-being. If you have gained value from this episode of the Mental Wellbeing College, I would be so grateful if you were to hit subscribe or follow, or to share this episode with someone that you love. This is how we continue to grow the show, get the message out, and to impact people in need by providing such information and strategies. Thanks so much for tuning in. It means a lot to us here at the Mental Wellbeing College. And now back to today's episode. This is really interesting what you're saying then about if we get back to the Mediterranean diet, it seems like there's a fair few randomized controlled trials, high quality experiments showing, like you said, that it can treat depression and lower depressive symptoms. Do you think?
Well, I would add a caveat there. I mean, I treat people who have very severe forms of depression. And, my own clinical practice really consists of using antidepressants or CBT, cognitive behavior therapy. They're my two kind of approaches to treating depression.
Okay. Yeah.
I am not at this point advocating that people use nutritional interventions as an alternative to CBT or medication.
Yeah.
I think that CBT or medication is more likely to work in the presence of a good diet. So I'm not suggesting that diet is an alternative to appropriate psychological or physical intervention. What I am suggesting is that these interventions are more likely to be effective in the presence of an appropriate diet.
Yeah, and I appreciate the caveat. And I think Felice Jacker and colleagues, I've seen one of their recent trials, the CALM trial, where they're potentially advocating for dietitians to have a role when wait lists for psychologists are full and someone doesn't have access to therapy or to pharmacotherapy, just as a tie-in before someone gets through to therapy. But certainly advocating for the role of dietitians to have a role in adjunct with other therapies.
Yeah. I'm not averse to that, but I do think that psychologists and psychiatrists should know more about diet, and that when they see patients who need CBT or who need antidepressants, that they give dietary advice. And I'm not suggesting that nutritionists shouldn't be involved. I'm not suggesting that at all. But I do think that at the end of the day, most people with severe forms of mental illness are treated by either a medical doctor or a psychologist. And I do think that those two professional groups should know more about nutrition and should be able to give good nutritional advice to their patients.
Yeah, I love that, Ted. And that's certainly the aim of this podcast, is to kind of communicate that out there. And I'm in fact doing my PhD on exercise implementation in mental health care. So getting psychologists to use.
Well, I mean, I think that, when you look at, psychological interventions, whilst I'm a big believer in nutrition. Exercise is absolutely fundamental in relation to, I look at, I've been around a lot of times since I've been a kid. I run, I still run marathons. I like running. I run most days. And, exercise is fundamental. And actually what is interesting is that if you look at people who engage in, let's say, moderately severe exercise, significant exercise, and who run a lot or who cycle a lot, they tend to have a far more diverse gut microbiota than people who don't. So there is a link up between the diversity in the microbiota and exercise. So while the primary determinant of your gut microbiota is your nutrition, exercise undoubtedly plays an important role as well. And and we don't know enough about the mechanisms involved there. I mean, I'm very interested in how myokines, which are proteins produced by muscle when we exercise, how myokines might impact the gut microbiota. But undoubtedly, exercise has a significant role to play in the gut microbiota as well. So if I was to say, what are the two things that somebody who suffers intermittently from depression, or perhaps more chronically from depression, or anxiety, or even stress, which isn't a disease at all, it's a risk factor. People who suffer from these conditions, I would advocate a Mediterranean diet, definitely, but I would advocate vigorous, regular aerobic exercise. And I think a lot of people don't engage in exercise. And of course, some people have a diet that's resplendent in fast food, ultra-processed foods that are no good for you, really, But exercise is extremely important.
Yeah, no, I love to hear the advocacy of lifestyle behaviors there, Ted. And I'm curious, does the impact on gut explain the effect of SSRIs at all? Because you mentioned that or a fair amount of serotonin is produced in the gut. Is there any sort of a link there?
Well, I think that there's 2 points I'd make, really. About 80% of drugs that are used routinely in Australia and Europe for treating all medical disorders, I'm not talking about psychiatric disorders, most of them, not all of them, most of them have a negative impact on the gut microbiota.
Right.
If you take an antibiotic, obviously, if it's a broad spectrum antibiotic, it's going to kill a lot of microbes in your gut. And it's going to take about 12 weeks for your microbiota to revert back to normal after a 1-week course of a broad spectrum antibiotic. So there is a relationship there. Do antidepressants have a good impact on the gut microbiota? Well, they're variable. Interestingly enough, the one psychotropic drug that has a positive impact on the gut microbiota is lithium, which is used less now. I still think it's a great drug for treating bipolar illness. But it does it tends to bring about a diversity in the gut microbiota. Now, what is, I think, worthwhile, for psychologists and indeed psychiatrists, is that all of the common neurotransmitters in the human brain are produced by microbes in the gut. So if you take noradrenaline, GABA, histamine, acetylcholine, these are all produced by microbes in the intestine. Now, I'm not suggesting for 1 second that these microbes produce the neurotransmitters and the neurotransmitters travel to the brain, because they don't. But that doesn't mean they can't influence the brain, because they might influence the enteric nervous system, which is the nervous system around the gut, which in turn can impact the brain. What is also, I think, worth bearing in mind, and this is something that if you look at your textbook of biological psychology, or you look at your average textbook of psychiatry, it tends to suggest that all of the tryptophan, and tryptophan is a building block of serotonin, that all of the tryptophan comes from our diet. And, most, textbooks will quote things like turkey as having a high level of tryptophan and all that, and there are many sources of tryptophan, obviously, in the diet. But what is not mentioned in most textbooks, because it's only relatively recently described, is the fact that certain bacteria, particularly bifidobacteria, are capable of producing tryptophan. So tryptophan is metabolized or produced by microbes. We showed, for instance, maybe 15 years ago, that, and I think it was the first study to show it, is that when animals ingested ingested bifidobacteria, that their levels of tryptophan in the bloodstream increased. So microbes within the intestine are capable of producing tryptophan, which is the building block of serotonin. And of course, serotonin crosses the blood-brain barrier and is converted into, tryptophan crosses the blood-brain barrier and is converted into 5-HT or serotonin, which plays an important role in eating behavior, sleep behavior, and of course, general mood as well.
Yeah, so a potential mechanism there for the gut in terms of mood disorders, potentially.
Indeed, absolutely. And, I suppose, over the years, I've worked in many areas of medicine, not just in psychiatry, but, I've seen, and I'm sure the psychiatrists and psychologists who have seen a lot of depressed patients will have come across people who, let's say, had their intestine removed. Maybe they've had inflammatory bowel disease, and their intestine is removed. And I've seen very intractable cases of depression emerge when people have had their whole colon removed, because, of course, they're missing this large, what I would regard as like a fermenter. The large intestine is like a fermenter. It's producing large arrays of molecules, which our brains and other organs in our body require. So if you're missing that fecal fermenter, which is the large intestine, it's not too surprising that there are mental health consequences. And I've seen patients at my clinic over the years who have had quite intractable forms of depression in the context of a total colectomy.
Wow. Okay. Yeah. That's amazing. I think it'd be very revelatory for psychologists and psychology students listening to hear about these links, because, like you said, I mean, it's just not taught at all in psychology training, at least here in Australia.
No, not in medicine either. No, they're definitely not. I mean, I hopefully in the future the deficit will be made up, but right now it is a glaring deficit in the education system.
Yeah, well, certainly I would recommend for people wanting, particularly psychologists wanting to learn more, the Psychobiotic Revolution. I picked that one up, and
indeed, yeah. It would say, look, there are good reviews out there. There's a very large review of mine in Physiology Reviews as well, which is over 120 pages long, so it's quite extensive. But the Psychobiotics Revolution, which Scott Anderson and John Cryan and I put together, it does provide a good readable overview of the topic of gut microbes and mental health.
Yeah, no, fantastic. I'll link that in the show notes for listeners. And just finally, Ted, I wanted to cover something that you mentioned earlier, which is the role of kombucha. So I have one here.
Yeah, indeed.
So I drink a lot of this every day. Yes, and it's billed and marketed as, good for your gut, and I mean, even here it says good gut feels and packed with probiotics. Yeah, and these pills, potions, things like kombucha, probiotic supplements, do they actually have a meaningful, clinically significant impact on the gut?
Well, I think they do. Now, look, like you, I'm somebody who would advocate taking yogurt or kombucha or kefir or whatever. For your average healthy person, I don't think that supplements are the way to go. I don't think you need to take a capsule full of probiotic bacteria if you're entirely healthy. I think maintaining good health is about taking in fermented foods like kombucha or yogurt on a regular basis. Now, I say a regular basis because the bacteria in these products do not colonize the gut. They don't start growing within our intestine. They go in our mouth, they go out our anus. So we need to take them in on a regular basis. So I think, what I would suggest is that, for good physical and mental health, I would advocate that people take in fermented foods on a regular basis. there are occasions where supplements are necessary. I mean, if somebody has irritable bowel syndrome, or they have, some other mental, maybe they're prone to stress or something, and in those circumstances, a supplement in the form of a capsule filled with bifidobacteria or whatever would be appropriate. But I think for most of us who are mentally reasonably stable, and anyone can get depression, that's for sure. But those of us who are not prone to depression, I would suggest that one just simply takes fermented food on a regular basis, and the more variety, the better.
Okay, I'll be eating plenty of yogurt and kefir then in the future, I foresee, based off that advice. That's excellent. Well, just finally, Ted, is there anything that you wanted to add to listeners? It's been great, and there's a lot of advice there packed in the short time that we've been speaking.
I mean, I think my advice really to psychologists would be, yes, use psychological interventions. They can be very effective. CBT can be particularly effective. But, within the context of an appropriate diet, you'll get your best outcomes.
Yeah, wow. Okay. That's excellent. Brilliant advice, Ted. And a lot for listeners and in particular psychologists. I really appreciate that. Thanks so much for tuning in to today's episode of the Mental Wellbeing College. If you've made it this far, it means you've gleaned a ton of value from today's episode, or you've fallen asleep. I sincerely hope that it's the former, and if it is, I would be so grateful if you were to hit subscribe, follow, or to share this podcast with someone you care about. Our mission here at the Mental Wellbeing College is to provide a free and accessible resource for people to take action and implement to improve their own mental well-being. And you subscribing, following, and or sharing helps us to achieve that mission and to impact people in need. Thanks so much for tuning in. It means a lot. We'll see you next week on the Mental Wellbeing College.